I'm Jason Cochran at Woodhull Medical Center in Brooklyn, where artists are trading art for healthcare.
So the Artist Access Program is a way for anybody who's making their living through creative means, artists, dancers, musicians, actors, they can bring their talent into the hospital and then receive credits for that and then exchange those credits for health care. There's lots of different ways for musicians and performance-based dancers as well to perform for both patients and staff. The pianist who you're going to speak to, Emil, he has played in two different settings. He's played at a chemical dependency graduation, so he's played music for the background of that ceremony. And he's also played at a staff relaxation lunch, so the staff were able to eat their lunch in the solarium and listen to him play.
Do you have health insurance?
No, I don't have health insurance. Because I'm a freelance musician and was not able to get health insurance. So this program is really exceptional. Actually, I got to use it very recently. I was in a bike accident and came to the emergency room here because I knew that I was in the Artist Access Program, and it worked out. It worked out well. They took care of me, and I don't have a gigantic debt. I was able to use credits to cover most of my expenses here.
So artists bank 40 credits per hour of performance, and those credits equal dollars evenly. So our fee scale system is, the minimum is 15 and the maximum is 60. Most of my artists are around $20 a visit. This is based on their income. It's a personal fee scaled amount. So if your fee scale is $20 and you perform for an hour, you then get your next 2 appointments they're paid for.
So if you were to, let's say, get a paid gig as the pianist here, how much do you think you would earn in dollars for that same hour? Anywhere from
25 to 100, depending on the location. And
so it sounds like a pretty good deal then.
It is a good deal, especially when you consider the cost of medical care. It would be many hundreds of dollars.
In 1986, pop artist Keith Haring volunteered his time here. He painted 2 murals. Now they're priceless.
I think it's a success on both sides. The hospital benefits from all this talent that comes in here every day to increase the life of our staff and our patients and the treatment that they're getting here. And then these artists, there's been over 550, maybe close to 600 artists who've in turn gotten free visits, free clinic visits, free prescriptions, free ER visits, because they've used their credits to pay them off.
So now that you've used this system at the hospital, do you think it would work in other areas of your life, like your rent or your groceries?
I think so. If it was fairly balanced, definitely. I think it's a great idea.
Did you know that Americans used to barter for their health care back in the old days?
I did not know that, no.
Yeah. No, it's true. George Washington actually traded health care in the last years of his life for whiskey.
So what we see here at the top of this page is Washington actually exchanging whiskey for health care. James Craig, who's mentioned here, is Washington's friend and physician, and he is ordering, we see hay and 30 gallons of rectified whiskey. That was the best, most purified whiskey you could get.